Joining me now from our Durban studios is Nehawu's KZN Provincial Secretary, Ayanda Zulu. Ayanda, very good morning. Just paint a picture for us on how bad the situation is, first of all.
Okay, thanks very much. Good morning, and good morning to the listeners. We, as the National Education, Health and Allied Workers Union in KwaZulu-Natal, we can indeed confirm that quite a number of patients are currently sleeping on the floor. Others are sleeping in the chairs. Others are also, they don't have the beds. They are no longer enough for the patients because the hospital currently have got about 900 beds. And you will recall that Edendale Hospital was part of those hospitals that were the pilot project for the implementation of the National Health Insurance. So the National Education, Health and Allied Workers Union, Nehawu, have been fighting for almost 2 years with the management of the hospital, together with the department, to say, let us have adequate equipment in the hospitals. Let us make sure that the infrastructure in the hospital is also in good shape so that the patient will get the services that they deserve. As the union, we feel that the management of the hospital does not have got capacity to lead the institution. The crises are deep, but they are also part of the deeper crisis that the public health system in the province is currently facing.
Now, Ayanda, you're blaming the senior management at the hospital. Isn't a capacity issue out of their hands? Aren't infrastructure issues out of their hands?
They are indeed out of their hands, but they have got also a role to play in making sure that other things other things that they have got capacity to do, they are taking place. Let me make an example. In other hospitals, we have made such a call for the beds, and the management of the hospital was always on the neck of the department in the level of the province to make sure that they deliver such equipments. So we think that in the level of the hospital, there's absolutely no will from the management to meet the union as well as the community halfway in addressing this issue.
Okay, so I just want to take you back a little bit to the Public Services Commission on the level of service at healthcare institutions in KZN. That report, one of the key findings was that healthcare workers were found to lack motivation and providing often inadequate care to patients. Those are some of your members that report is talking about. What are you doing about that as Nehawu?
You'll remember that part of our call as Nehawu, we have been very, very consistent to say part of the problems that are facing the public healthcare system in the province is the high vacancy rate for both clinical staff and the non-clinical staff. Our members are subjected to assist more than what is expected from them. So we have been making a call to say the government, the Department of Health, must fill all the vacancies so that our members will have less burden, so that there will be less mistakes that will be committed. That's why tomorrow, Nehawu in Pietermaritzburg will be having a very, very big picket that will be coinciding with the provincial treasurer's budget speech to say, now we are sick and tired. We want all the vacancies that are funded, that are vacant, to be filled with immediate effect. We think that part of the bigger crisis facing the public healthcare system is that is the issue of vacancies. And we think that for the smooth implementation of the National Health Insurance, the issue of the vacancies is at the center.
Sorry, I can understand what you're saying about you've got vacancies and so forth that does affect capacity to a certain extent. But when a person goes into a clinic or a hospital and they are not treated well by a nurse, we've seen patients being chained to desks and so forth in the past. surely that's not a capacity issue. That is an issue with your members, that they're not treating patients as they're supposed to treat them.
In the level of Nehawu and our members, that we have now came up with a theme that is called the behavior of a progressive civil servant. Our members that are serving in the public, in the institutions, they are now aware of their conduct. You remember that Nehawu is a progressive trade union. It does not only concentrate on what is happening on the workplace. So our struggle are also extended to the community struggles. That is why it's very important for Nehawu to have got a good relationship with the community. That is why we are advancing this struggle of having progressive public servants that will be able to put the issues of the community forward. That's why members of Nehawu, they go all out in public hospitals to assist the patients, regardless of the fact that they are understaffed.
All right, thank you so much. That is Nehawu's KZN Provincial Secretary Ayanda Zulu there, just talking to us about a particular situation we're focusing on Edendale Hospital in Pietermaritzburg, where the patients were sleeping in waiting rooms and also on gurneys as well.